Lainey Kitt watched the September 11th attacks from her office window. The towers fell right in front of her eyes.
And did you stand here watching them?
Yeah, I saw everything come down and then that plume.
She breathed in dust and debris as she rushed out of the area. Then she was back at work in Lower Manhattan after just 3 weeks. She's still working in the area 14 years later and says her health continues to suffer.
We didn't know how dangerous it was, and now we know.
Like many survivors, Lainey has been diagnosed with asthma, reflux disease, anxiety, and post-traumatic stress disorder. She finally found help at the World Trade Center Environmental Health Center, which is treating nearly 8,500 survivors. Many lived, worked, or went to school in the area.
This population was often being forgotten in terms of their World Trade Center exposures, or they often felt like they were not the heroes, that the responders were the heroes, and therefore they were not deserving of care.
Dr. Joan Reedman says, unlike responders, survivors did not have disaster training, which made them even more vulnerable to mental health issues.
This is an exposure they're not really trained to handle.
How do you feel today?
How do I feel today? I feel a lot better than I did 7 years ago.
Lainey hopes other survivors who haven't been treated will get help.
There's a way to get better, and I feel better.
Kenneth Craig, CBS News, New York.